So this oral health awareness project kind of came out of a bunch of us hygienists who think very similarly, where we really are passionate about prevention and what we can be doing for our patients. And we see a big disconnect with just a lot of the communication that's going on.
Hey, everybody, welcome back to a very, very special episode of Gloves Off. Normally, these are quick hits, which you all know, but today we're going to take a deeper dive because I have two of my favorite people. Bethany, how are you? Melissa, how are you?
Awesome. Happy to be here.
Yeah, I'm great. Thanks for having us.
Awesome. So it seems there's this war out there between hygienists and dentists and assistants and hygienists. And, you guys decided to build something better, an oral health awareness project. And I think maybe people have no idea what that is, and they have a negative perception of it. But like, what are we really doing in dentistry today? And what is the goal?
Yeah, so this oral health awareness project kind of came out of a bunch of us hygienists who think very similarly, where we really are passionate about prevention and what we can be doing for our patients. And we see a big disconnect with just a lot of the communication that's going on. And David, it kind of goes back to like in the time of COVID, where there was a lot of like, dentists versus hygienists, like hygienists don't want to come back to work. And dentists are like, I have a business, I have to run. There was a lot of stuff going on. And I think like this project, although it's happening now, even kind of dates back to that. So we still have this issue where we don't have as many people in the practice that we need to be doing our jobs and for the businesses to function properly. And dental hygienists weren't really happy with a lot of things that were happening back during the COVID age. And it was kind of like a turning point for them to kind of say, hey, you know what? I don't like this, and I'm going to kind of turn this way and do something different. And that turn meant they went to temping. And that kind of shifted the balance, right? So a lot of them left, a lot of them went to temping. And then there was this offset within the profession, and it drove up the cost of hygienists, and it started a little bit of some tension in between dentists and hygienists. And then fast forward to there was proposition at the end of last year to start to bring this new person into the dental field to kind of close this gap, which is the oral preventative assistant. And so our oral health awareness project came to be because a bunch of us who are very passionate about prevention and the connection with systemic disease, and we practice at that level that our education taught us to practice at, we're like, hey, this isn't what we know now. This isn't going to help the population. It's actually potentially going to make our periodontal disease prevalence worse, because this person now doesn't have the education in the background that we have to identify the disease and also identify the systemic links that might show up first in the mouth, because they just don't have that education. So that was our concern, is we wanted to come together and we wanted to let the public know, what is a dental hygienist? Because Bethany, I'm sure you could share, there's been so many times my patients are like, you went to college for this? You have a degree? Really? The doctor didn't teach you on the side? So the public still doesn't even know in 2025 who we are and what we do. But David, I would argue we're one of the best kept secrets in healthcare, because when we're managing oral inflammation and we're managing that pathogenic biofilm properly, then we're actually helping to reduce so many systemic health risks for our patients.
100%. And I mean, and I'm going to say minimally when we're doing our jobs well, we get two bites at the apple per year. And for patients who are not healthy, which is turns out a pretty large percentage of patients, we're seeing people every 90 days. That's far more frequency and opportunity to make a difference in our patients' lives than their physician. And I don't know, Bethany, like, what's your experience been on the medical side? I know I can't even get in to see my physician for 6 months. That's crazy.
Right, right. Like it's so hard to be able to see a provider. And so I think that in dentistry, we've just been positioned in this very unique opportunity to where we can have eyes and hands on patients so many times throughout the year, and oftentimes we are the very first people that are detecting abnormalities, or we're seeing the beginnings of body-wide inflammation. And our patients, I think they know that and they don't know that. And so that's really the heart of our organization, is we want to educate the general public on the value of disease prevention that a college educated licensed dental hygienist can provide. And we also want to make them aware of the potential risks that can come along with seeing a provider that maybe hasn't received that much education or training. The practice of disease prevention, it really can't be taught in like a weekend crash course or on the job training. It really takes years of college education. And so that's really our angle. And we want to make sure that our fellow dental peers and colleagues understand that we're not here to battle against one another. I think we've been doing that for long enough and it's not getting us anywhere. But we want to work collaboratively in protecting the standards that are currently in place in many states. And we also want to elevate those too. We'd like to see where dental hygienists are put in positions to where they can access more people and improve preventive care for a greater number of people in our population. So that's really where our heart is.
I love that. So how do we bring that from like a heartfelt place and a strategic place to a place of execution where that actually gets to happen? Because there are things that push back, right? I mean, let's be honest. If you're in a PPO practice, you're probably working with some insurance companies that pay you less than what it costs you per hour to have a really skilled hygienist do this. So like, how do we bring it to life in a typical dental practice, not the top 10% or the bottom 10%, but, in an everyday practice?
That's a great question. And I really think it comes down to educating our patients and having the structure in your appointment time so that you can do that. And, technology also is a thing, to have the right tools and technology to tell that story to the patient and be able to maintain your schedule. Those are some of the things that really help the patient understand, because once they have the education to back it, it's a lot of times, we as dental professionals, and I've been through this myself over the course of my career. I used to opt people out of care because I assumed I knew what was in their wallet and I assumed I knew their priorities. But when I made that shift and I just started to, take my bias out of it and come to the table to truly help people. And at the end of the day, they can make any decision they want. It's their body, their health. But I have to do my job and lead them there. So I think it's really, number one, we need to do more collaborative education together, dentists and hygienists. We go to big conferences and dentists go over here and learn about, restorative, and then hygienists go over here and we learn about preventative. We don't do that together. We need to do that together so that we can be calibrated and on the same page. Because when I work with my doc and I understand his philosophy of care, and at this point in time, after being with him for as long as I've been with him, I could look at a tooth and I know what he's going to want to do with this tooth. So I could tee him up for that, because at the end of the day, I know that the patient is going to need this to have less issues in their life and they stay healthier. So I think we need to come together, number one, to just really calibrate as a team and understand our roles and what we do and how we help together, working in this collaborative way, the practice, so that the practice ultimately will be more profitable. Because yeah, hygiene is not the most profitable thing, right? That comes out of the dental chair, but the conversations that happen in the hygiene room create the profitability that goes over into the operative chair. And so I think it's a lot of trust building, and it's a lot of just being on the same page, understanding the mission and the vision of the practice, and really bringing the team together so that they can educate patients.
Yeah. So you mentioned a couple of really key things, Bethany. I'm curious if like which one or ones of those like really hit with you. Sort of team-wide education to get to calibration, which I think is often missing. Even in practices that have three hygienists or three dentists, like the dentists don't even think alike. So how in the heck can we have like one vision for the whole practice? And then the third one was like, there's some technologies out there that can help us too. So like education is important, Bethany, but like, what do you see from a tech standpoint? What do you see from a calibration standpoint that's in dentistry today that's helping maybe us create opportunities in our practices that most people don't really recognize or see quite yet? Maybe they haven't been exposed to it yet.
I think as far as technology goes, social media is a huge untapped way for us to communicate with each other and communicate with the patient base. And as important as it is for our dental teams to have this collaborative mindset, I think what's going to help us to see real change in our industry as a whole is inviting the patient population into the equation, because I think the root of a lot of our problems in our industry right now, it comes down to finances. It comes down to our team members are trying to navigate the rising cost of living, and practice owners are also trying to navigate the rising cost of doing business. And then we have this third party, the benefit plan providers, that they're not raising anything. And so I think ultimately that's the big problem that we have found ourselves in, where the everyday practice, they're just struggling to make it by. And we've been relying for many years on our different professional associations to find a solution to these problems. And we just haven't seen that happen. We haven't seen a dental insurance reform, and I don't know if that's even realistically on the horizon. I think it's kind of hard to expect that when some of our associations are even partnering with these companies. And so what our main goal with the Oral Health Awareness Project is to create a series of public service announcements where we can educate the general public on the value of the care that today's dental hygienist provides, and the risks associated with lowering those standards. And we want to put the ball in the people's court, because ultimately what can really cause or lead to an insurance reform is the patient subscribers putting their foot down and saying, I didn't know that you guys were only reimbursing this much. Why? I need more from you guys. I'm not going to renew my policy with you if you're not going to provide, very basic reimbursement rates for the care that I need. And so we really need to partner with the general public. And we've seen where these PSA campaigns have been very successful with a number of things in the past. I mean, if you even think about the tobacco industry or Moms Against Drunk Driving, so many different things where when we started to educate the people on the problem that was at hand, they stepped up and they spoke to legislators and they spoke to their policymakers and they spoke to the appropriate parties, and that ultimately is what caused change to occur. So that's what our goal is with the Oral Health Awareness Project, and we're hoping that by educating our patient demographic, that we will start to see big changes in our industry. It won't be overnight, but over time we'll start to see these big changes to where suddenly dental practices are receiving reasonable reimbursement rates that allow them to pay their lab fees and allow them to pay their staff and allow them to actually thrive in today's society. So that's where we're headed.
I like that a lot. So you've obviously been putting the word out there for some time now. What are you seeing starting to come back to you from being this voice as a group?
Do you want to go, Melissa?
Sure. I mean, it's kind of been varied, honestly, David. Some people are, happy to see. I think it's still too new to really make a dent in what we need to see with the public.
Sure.
We're doing activities like this and we're raising awareness within the industry. And I think that that's helpful because again, if we can collaborate together, if the ADA and the ADHA and all these other, associations potentially can come together and go to the insurance industries and say, hey, this is a problem here. Maybe we can start to make a dent in that. And like Bethany said, with people coming forward and saying, yeah, this is my employer that's providing this to me, but it doesn't really provide me with much of a benefit. What could we do differently? We really need to get the word out more still so that we can help make change. So, doing things like this with you, and thank you for allowing us to come on here and share. Hopefully we can start recruiting some people who think similarly to what we're saying today and really put some, lay some roots down, because we're a small group. What do we have right now, Bethany? Like 600 members, right?
Yeah.
So we've done a lot with a little bit, but we need to keep on going. So if we can recruit more people to join us, and we can have, we would love to see dentists come on and work with us and really move this initiative forward. So that's what I would like to see. It hasn't been, a huge impact just yet, but we're just getting started.
Well, first of all, like you totally shocked me. You guys are already at, so you think 600 is a low number. I think like what you're already at 600 members. That's really impressive. So, and all right. So first of all, if I'm a hygienist and I want to be involved, how do I do it?
You want to take
Best,
this one, Bethany?
yeah. Best way is to become a member of our initiative. So if you visit our website, which is www.oralhealthawarenessproject.org, you will find that there are some different membership tiers. It doesn't really matter which tier you choose, you're going to get the same benefits. It just comes down to what financially you're able to do. But that would be a great way for hygienists to support us. And it's not limited to hygienists. We have many dentists and even many non-dental professionals who are members of our organization because they believe in the work that we're doing and they want to see change in our industry. And so membership is open to anybody. It's not just limited to hygienists. So that would be the best way to support us. And to kind of piggyback off of what Melissa was saying, these past few months, we officially signed papers with our public relations firm back in August. And so we are right now in the very early stages of developing our PSA campaign. A lot of the groundwork that we've been doing is to educate our fellow dental peers on what we're doing and increase membership. But to your point, with a little over 600 members, we've been able to raise nearly $100,000 for the work that we're doing so far. So I'm very grateful for the support that we've received so far, and we would love to have more support from people in our industry so that we can really see the change that we're wishing for.
I'm glad you said dentist too. I was going to go there second, but I'm glad you brought us into the fold because I feel like, yeah, this we before me has got to be a mindset that we come to the table with, or nothing, amazing will happen. Like good things will happen. So we need amazing things to happen. How about on the industry side? Are you starting to see some industry partners come on board and say like, hey, this is important?
Yeah, so we do have a corporation membership tier as well, and we do have some corporations that have donated and joined into this movement. A lot of companies that provide products for dental hygienists specifically to be able to do their work, that might be impacted by the OPA movement in the future. We don't know. So there's definitely a lot of corporate support as well. So that's been nice to see too.
That's really cool. And how about so obviously we've got virtual meetings, we can do things like this, social media. You mentioned Bethany is a big deal. We can see a lot of each other there. Will you guys have presence at any upcoming trade shows that are as that meeting season starts to roll in the fall and the winter?
Yeah, I think so. We're actually planning on October 25th a peaceful demonstration in Washington, D.C. And it's going to be an opportunity for all dental professionals to get together and just have a joint presence to support standardized care and the value of disease prevention. And it's actually going to be very close to ADA SmileCon. And so any attendees that are going to that convention, we would love to see them. We'd love to have them out in the crowd with us when they have some breaks in between their courses and things. But we are going to be making plans to be present at some other events, but that's our next upcoming one.
That's like the next biggie.
Yeah.
Yes.
I like it. I like it. Well, Dr. Brett Kessler, I'm just going to call you right out, buddy. We need your help, man.
We'd love to give them a high five.
Absolutely.
Yeah, Brett's a great guy. That's a great guy. All right. So winding it up, give our audience, like, give us a next step. I know we're going to the website. I know we're doing that. Like, give us something concrete to latch onto and charge us so we can help make something happen.
Well, following the Oral Health Awareness Project on social media would be great because as we're putting, this awareness campaign out, sharing that with your audience, sharing that with, your anyone that you know, sharing that with the public, letting patients know, every time you have a conversation with a patient, letting them know that their oral health is directly connected to their systemic health and what we do and why it's important. I think those are the first two things that popped to my mind. How about you, Bethany?
Yeah, I would agree with that. I mean, I think for anybody watching or listening to this, to just ask yourself, do I value disease prevention? Do I value quality care? Do I value safe and effective care for my patients? And if your answers are yes to those things, we would love to have your support as an OHAP member. And so that would be my advice, is just to really give this some thought. And if you feel like your philosophies are aligned with patient health and wellness, to visit our site and join us in your membership.
I love it. Well, thank you so much, Melissa. Thank you, Bethany, for being here. I love what you guys are doing. It's really important. It's been a long time that we have been warring with each other. It's about darn time we actually started hugging this thing out and getting our patients to the best place possible. So I really appreciate you both being here today. And I probably won't see you in Washington, but I'll definitely see you soon.
Sounds good. Thanks,
Sounds good.
David.
Thanks for having us.
Bye, ladies.
Bye.
Bye.